U.S. At 18:06 or 6:06 p.m. tonight, we received a call here at the Loma Medical Center that there was a suspect, possibly an active shooter, that had planned on actively shooting kids here at the hospital, obviously patients here at the Children's Hospital. We have staff that work here 24/7, so the deputies that work here were immediately on scene, and our allies from across this county and our neighboring county in Riverside were all here within minutes. We have a response of about probably 100 to 200 law enforcement officers that came here. Our SWAT team immediately started organizing the elements that they were responding and assigned them by floors to immediately clear those floors. As they cleared the floors and we started receiving actual ground intelligence, fortunately I'm able to report that we have not found any victims and we have not found an active shooter as it relates to this call, and the call does appear to be false. I want to commend not just the law enforcement officers that responded here, but the staff here at the hospital. It was very obvious that they practiced and had these protocols. They protected patients by barricading them and preventing a shooter from accessing them. And I can tell you right now, I feel 10 feet tall. I'm so proud of all the law enforcement agencies that responded here. There was no waste of time. They immediately made entry and they did what we are trained to do. And that's try to seek out suspects that would harm anybody in what could potentially be a really drastic situation. But again, I'm glad to report that's not the case. So I can only imagine the next question is going to be what's next. What's next for us is to try to take the evidence from this call and try to obviously identify the suspects. Unfortunately, I've been part of many of these calls and worked with many of you on what we call swatting calls. Many of these things, the suspects mask these through IP addresses from places that could be even outside the United States or in other countries. It does sound like we do have some evidence available on this specific suspect. I'm going to be very vague about sharing any of that with you right now, because the one thing I want this suspect to know, this is the wrong county to do those things in. As you can see the response of our allies tonight, we don't play. And if there is evidence and we can find you, you better watch your door because we're going to be kicking it. We don't play. We put our people in danger here. Think about all the patients in the hospital that weren't receiving medical treatment, all the law enforcement officers that could have been answering emergency calls. This is something we take very seriously, and I have detectives on the ground, intelligence crews. We're going to be working with our federal partners out of the Riverside FBI office, and if there's anything we can do to identify this suspect, I can assure you we're going to do just that. So I'll be more than happy to take any questions.
What was the call?
The caller called, I've listened to that call myself. The caller called and said that he was armed with an AR-15 and also had a bomb, and that was suffering from mental health crisis and hearing voices, and the voices were telling him to do what he was saying he was going to do, which was shoot up the hospital and the patients here.
Did he say he was here or?
The description that we had for the 911 call when it came into dispatch, that he was here on scene.
So at this time, you really don't know where the call came from, if it's from whether the state, the city?
We don't. And like I said, unfortunately, through IP addresses and modern technology, a lot of those things can be masked. It's certainly my hope that we'll be able to use evidence from the call itself and be able to do the best we can to trace this call and find the suspect or suspects that were involved.
What was the disruption to the hospital? Any emergencies? How many people were evacuated during the response?
Well, I don't have exact numbers. I do have close to exact numbers in terms of the law enforcement officers that responded. But folks, this is a big hospital. It's a trauma hospital, and this is specifically the Children's Hospital. It's packed with patients all the time. You can only imagine hundreds, if not 1,000 people inside that hospital have been affected by this, and just affected the entire community across the board here in San Bernardino County and even Riverside County in terms of the law enforcement presence that's here tonight.
That was a pretty terrifying call, and I know you guys trained for this, but not truly to do a worst case scenario.
Absolutely, we do train for this. It is a worst case scenario because you essentially have victims that can't defend themselves. So, and especially when you're talking about children, their families that are here, and if you can only imagine the weight of what they're dealing with in the first place, only to have that happen. That's why I say I can't express enough the gratitude I have to the medical staff here, that the things they were able to do. I listened to this call while it was going on, while I was responding here myself, To hear the deputies and law enforcement officers contact the medical staff that were barricaded trying to protect their patients, I mean, phenomenal. You think about the things they do, they are true heroes day in and day out in terms of being able to take care of our children in this case, but to take it the next step further and actually protect their lives physically, very commendable. The law enforcement officers that responded, there was no waste of time, folks. They immediately got in there, and the presence, I'm very thankful as the Sheriff of San Bernardino County to have the allies and the partners we have, the CHP, all of my 10 municipal police departments, my Riverside Municipal Police Departments, and certainly Riverside County Sheriff's Department. Thank you all.